Good afternoon and welcome to our Tuesday, May 12, 2020 Council Study Session as we'll continue our discussions on the proposed budget that is now in front of City Council. We do want to begin, though, with an update from the Springfield Greene County Health Department. So, Mr. Gage, I think we'll start with that, sir.
Yes, we have Clay Goddard, our director from the Health Department, and Clay will give us an update.
Good morning, sir.
Good morning, Member McClure, members of council. Always a pleasure to be in front of you. I want to start my brief remarks with a case update. As of this morning, we are sitting at 103 cases. We didn't have any new cases over the weekend and have yet to have a new case this week. And we're hopeful that this positive trend continues. But we need to be mindful and remind people that COVID-19 is not gone from our community. It's not gone from our state. It's not going anywhere anytime soon. And I continue to be asked when we can return to normal. And we're going to need to continue to pursue a new normal for a time as we maintain our vigilance against this disease. We need to continue to physically distance when possible and stay home when we're sick and wash our hands and use hand sanitizer. And you might be tired of hearing about it, but testing will once again be a theme for this update for you today. This is because, for one, testing is a key component of our community's response and recovery. But also, it's nice to share some good news. And I think in this situation, we all need good news on a regular basis. On the asymptomatic testing front, we have received 150 results from the 200 asymptomatic tests that we offered for essential workers. Thus far, I'm happy to report we have 0 positives from that group. And I hope that that continues as we receive the remaining 50 results. In more good news, our hospital partners have begun testing many of the patients who receive elective surgery at their facilities, and that's going to give us further insight and more data into this disease and a better sense of where we stand as a community. Additionally, thanks to funding from the Missouri Foundation for Health, the Springfield Greene County Health Department has been able to enhance our existing lab equipment, and we're able to do in-house COVID-19 testing. We've started using that as an epidemiological tool just today, and this move will allow us to test all close contacts of our confirmed cases, whether they are showing symptoms or not. This is an investigative tool to further understand COVID-19 in our community and will help us effectively break the chain of infection when we find positive cases. I want to be clear that that does not mean that we're offering testing to the general public at our department. Those with even one symptom of COVID-19 should be contacting their healthcare provider for referral to testing. I want to again reiterate that anyone who is experiencing barriers to testing should let us know. We don't want anyone to go without testing who needs it. Anyone who needs help getting access to testing should reach out to us at our hotline at 417-874-1211. I am so proud of how our community partners have come together to expand testing. However, we know that barriers still exist. Around the country, we are seeing that COVID-19 is disproportionately affecting people of color or otherwise marginalized groups. We know that these groups have suffered a history of lack of access and perhaps do not trust our healthcare system. We know that there's been a long history of societal and economic barriers to many groups represented in our community. We don't want anyone to feel like testing is not open to them. Last week I mentioned that we are working with the NAACP, Prosper Springfield, and CPO's Caring Communities to ensure a pipeline to access testing. Of the 39 tests we have scheduled so far, we have 32 of those results back, and I am again happy to report that all have tested negative. We continue to look for other groups in our community to connect with as well. We are currently working with the Latino community and our homeless populations to connect to testing and have future plans for other specific groups, like those working in personal care services or refugees. This expansion of testing on multiple fronts will add further data to our community's understanding of COVID-19 and will help us better prevent the spread of this disease. I would again reiterate, because I can't say this enough, that we don't want anyone who is experiencing symptoms to not be able to get testing. We don't want anyone to dismiss symptoms as just a summer cold. Testing is our only window currently into this illness, and our continued recovery efforts are hinged upon thorough testing. So if you are having any issues accessing care or getting tested, we'd ask that you once again call our hotline, 417-874-1211, or email us at coronavirus@springfieldmo.gov. And you can even live chat from our website. All of those resources are staffed Monday through Friday from 8 until 5. Finally, I would say that we are looking in our crystal ball, if you will, and trying to think about what the next steps of recovery look like in our community, working on a guidance document that we hope to be able to provide to you soon. Jason, I don't know if you have thoughts on when we feel that could happen.
Well, first to add to that, I think for a lot of people as they try to plan out especially what the summer might look like, it's very helpful if we can provide some guidance as to where we think we may be, assuming that our medical and health information is still very, very good. So I think I appreciate the initiative with Clay and his staff and others involved to try to do that. I would think, and I would obviously defer to council members and Mayor, to your thoughts on scheduling, but it's something we'd really like to get to fairly quickly and possibly as early as Friday, schedule permitting. We could certainly, if that's a date that works, we're talking about a council lunch or workshop setting, depending on the time of day, something we could get everyone together. I think, Clay, if you think that you could be ready to have information that we could really kind of dive into, it would be great to have that conversation as early as Friday if we could get it scheduled.
I think that's a doable timeline, yes.
Well, I know you and your staff have been thinking as to what the next steps are, when they are rolled out, and the impact on that. And as city manager mentioned, we've got a lot of summer events. People need to make plans, and as clearly and as quickly as we can at least give some guidance, I think would be extremely helpful. So, Ms. Cotter, I might ask you if you would maybe to work with council to try to set up a study session that we could go through Mr. Goddard's suggested approaches and start weighing what those impacts are.
Yes, sir. I'll send an email out to council this afternoon.
Very good. Let me ask you, Mr. Goddard, I'm so pleased with our case count here and what's been really good numbers here over the last few days. Can you give me some guidance on what's happening in some of the surrounding counties? One of my concerns has been that outstate Missouri may not have even reached its peak. That's just me speaking, but I'd be interested in any thoughts or numbers that you might have.
So we continue to track what is going on in neighboring jurisdictions because obviously that does have an impact on our healthcare infrastructure. Obviously, being a medical and commercial hub, people travel here. And some of you may or may not be familiar with Region D. It's a highway patrol geography that they use. And if you exclude Greene County, that would be 18 counties, and then we've lumped Laclede County into that number as well. And over the last 7 days, they've had 19 cases. Which is quite a few. So we're going to continue to watch that. We're interested in what the impact of reopening means. We believe that there will probably be some consequence to reopening. Certainly we've cracked the spigot a little, and we aren't as wide open as some of the other surrounding communities. So that's data that we're going to have to keep our eye on, and I think that that's pretty important.
Mr. Hosmer?
Clay, we still got a problem with the number of tests, or do you think there's sufficient tests available to test anybody that needs it or anybody that it'd be recommended from a public health standpoint?
At this point, testing supply has not been a problem. It is one of the capacities that we have on our dashboard. And there's been some studies done. They've thrown some numbers out. But really, the more important number to look at is the number of tests that are coming back positive. And let me explain that a little further. Hopefully, I can help us all make sense of that. If you have enough testing that you're able to open it up to high enough bandwidth that you're testing under 10% positivity rate, that means that you're probably testing enough symptomatic people to really know what's going on in your community. And we're running somewhere around 3.5% of all of our tests were coming back positive since we first started having positive cases in March. So that gives me some confidence that we have enough testing bandwidth. And then what I just brought online, what our lab brought online, adds 3,000 more kits to that bandwidth. So I think we're in a good place compared to many jurisdictions, both in Missouri and across the United States.
One thing I had read, and I don't know if it's something that could be helpful, but that I think in Nebraska, they were actually batching testing. Since your positive number is 3%, they could batch 5 samples tested. If there was no positive, all 5 samples would be then presumed negative. And if there was one positive in the 5 sample, then they would actually do individual tests. But it seemed they were saving pretty significant numbers because there's such a low positive percentage. Does that make any sense for?
I'd be interested in reading about that methodology for sure.
I think it was somewhere in the state of Nebraska, which I think is where one of the federal infectious disease facilities is located, but it might be something to look at.
Okay. Thank you.
Councilman Lear.
Well, thank you for your update and for your work. I know that there's been a lot of press about food industry, food processors, and I know we have some in our region, which would affect as you say, our healthcare infrastructure. Do you know if those are being proactively tested?
I know that the state has increased interest in that, Councilman Lear. What happened up at Triumph Foods in Buchanan County was certainly very troubling. And one of my peers, Dr. Rex Archer with the Kansas City Health Department, has struggled with that event. So essentially at that plant, they have many workers who are either first-generation immigrants or refugees that work there. They live in North Kansas City. They take buses together and then work shoulder to shoulder. So that's something that we have to keep an eye on, and I know that the state is working on those strategies to make sure that we've got enough testing for those types of plants. That's one of the reasons that we continue to really look at strategies to find individuals who might otherwise not access testing. We want to make sure that we've got a good representative testing program that's pretty critical to a community's success.
Councilman Simpson.
Continuing in the vein of testing, saw a few days ago that the FDA had approved had given the first emergency use authorization for an antigen test for COVID-19. Is that something that is we think in our timeline to be able to use? I know that would be quicker and more scalable than some of the current tests, or do we feel that the accuracy is maybe not quite there yet?
I think it's getting better, and I think that by the time that we get ready to enter that phase, we'll have better answers for you. I know that the FDA has approved 12 manufacturers for seroprevalence testing. I think that's going to be an important piece to the puzzle. Some of it will depend on CARES Act dollars to help fund that. The state is not going to fund a significant amount of testing for statewide, so that will be part of the proposal that we make to the Greene County Commission, and we're still in the process of putting that together. But look for more information coming soon to regard of what we think that plan looks like.
Thank you.
Well, Mr. Goddard, thank you for the continued excellent work by you and your staff and the leadership, the guidance that you're providing for Springfield and Greene County. Thank you is not strong enough. We're deeply appreciative.
Thank you, Mayor McClure.